Hello, everyone. Your girl Tay here from Let's Talk Wild, bringing you some more animal news. This time, the CDC has issued a health advisory after a human infection of bird flu. Okay, so we are going to get into that. But before we do, make sure you guys subscribe to the YouTube channel. Make sure you guys check out some other videos here, the podcast episodes, some celebrity pets and animal interactions here on my YouTube shorts. Make sure you guys give the girl a thumbs up, a subscribe, okay? It will really help your girl out, okay? So, y'all know I am on a time limit, so I want to get in, get out because the baby is down for her nap. I don't know when she's going to wake up. It could be any moment now, it could be later on. So, I want to get right into the things of the things, okay? So, health alert by the CDC. Let's get into it, okay? Hope you guys are safe out there. Anybody that has, poultry and stuff like that or works around, these animals and stuff like that can have these viruses and stuff. I am going to pull myself down. We're going to read through the press release, the health advisory that the CDC released, giving us more information on what's going on. And yeah, and then I'll come back up, give my thoughts, and then get on out of here. And y'all already know if it goes too long, I will leave timestamps in the description. Okay, so let me pull myself down. Here we go. Okay, so the avian influenza A, H5N1 virus, identification of human infection, and recommendations for investigations and response. Okay, so the summary: the Centers for Disease Control and Prevention, CDC, is issuing this health alert network health advisory to inform clinicians, state health departments, and the public of a recently confirmed human infection with the highly pathogenic avian influenza, H5N1, so on and so forth, virus in the United States. Okay, following exposure to presumably infected dairy cattle. The U.S. Department of Agriculture. We'll need to read all that. Okay, so now down to the background of who was tested and infected. A farm worker on a commercial dairy farm in Texas developed conjunctivitis on approximately March 27th, 2024, and the words is messing me up. Where is my moon water? Y'all know it was the eclipse. Y'all hope y'all made some moon water, some eclipse water. Okay, let me take a little sip. And subsequently, yes, thank you, tested positive for H5N1 virus infection. I'm just going to say H5N1, okay? Now, the viruses have been reported in the areas dairy cattle and wild birds. There have been no previous reports of the spread of the HPAI virus from cows to humans. The patient reported conjunctivitis with no other symptoms, was not hospitalized, and is recovering. The patient was recommended to isolate and received antiviral treatment with, that medication right there that I will not be trying to pronounce. Okay, hold up, that right there. Now, the illness has been identified in the patient's household members who received. Ooh, Oh, it has not been identified in the patient's household members who received the same medication for post exposure. Okay, so no additional cases of human infection of the virus associated with the current infections in dairy cattle and birds in the United States, and no human to human transmission of the virus have been identified. Okay, so the CDC has sequenced the influenza virus genome identified in a specimen collected from the patient and compared it with the HPAIA H5N1 sequences from cattle, wild birds, and poultry, while minor changes were identified in the virus sequence from the patient specimen compared to the viral sequences from cattle. Both cattle and human sequences lack changes that would make them better adapted to infect mammals. In addition, there were no markers known to be associated with influenza antiviral drug resistance found in the virus sequences from the patient specimen. And the virus is closely related to two existing, okay, HPAI, H5N1 candidate vaccine viruses that are already available to manufacturers, which could be used to make a vaccine if needed. So they already got a vaccine ready if, things get out of hands, allegedly, supposedly, Now, this patient is the second person to test positive for this virus in the United States. The first case was reported April of 2022 in Colorado, and a person who had contact with poultry that was presumed to be infected, okay, with the virus. Now, currently, the viruses are circulating among wild birds in the United States, associated outbreaks among poultry and backyard flocks, and sporadic infections in mammals. The current risk that these viruses pose to the public remains low. However, people with job related or recreational exposures to infected birds, cattle, or other animals are at higher risk of infection and should take appropriate precautions outlined in the CDC recommendations for farmers, poultry, backyard flock, and livestock owners, and worker protection. Okay, so if you guys work with these animals, make sure you are up to date and know what you need to do. Okay, so the CDC, a lot of people, were concerned about the dairy cows and the milk and stuff like that. So the CDC continues to work with the USDA, FDA, and state health departments to monitor people exposed to animal infections with the viruses. Okay. The FDA does not currently have concerns about the safety or availability of, pasteurized milk products nationwide. Pasteurization has continually proven to inactivate bacteria and viruses like influenza viruses in milk and is required for any milk entering interstate commerce because influenza viruses constantly change. Continued surveillance and preparedness of efforts are critical. CDC is taking measures in case the public health risk assessment changes. This is a developing situation, and CDC will share additional updates as new relevant information becomes available. Okay. So they saying right now it's low, but no case of severe illness or, F of with the virus infection has been reported in the United States. Since 1997, more than 900 sporadic human cases of the H5N1 have been reported in 23 countries. Hold up, where we at? Okay, yes, in countries with more than half of these cases resulting in F. Okay, offness. Y'all know YouTube, you can't say certain words. Okay. However, since 2015 and 20 through 2016, human cases have decreased. And only a small number of sporadic human cases have been reported worldwide since 2022. Okay, wow. Clinical illness with the virus infection has ranged from mild disease, okay, conjunctivitis and upper respiratory symptoms, to severe or critical disease, pneumonia, multiple organ failure, and sepsis, and, the offness. Okay. Now, then they have some recommendations for some people. They include instructions for infection prevention and control measures using personal protective equipment, PPE. For the people that work in the healthcare system, you guys already know. Testing, antiviral treatment, patient investigations, monitoring of exposed persons, including persons exposed to sick or, off wild and domesticated animals and livestock with suspected or confirmed infections with HPAIA H5N1 viruses and antiviral, chemo, whatever that is, of an exposed person. Okay. Now I'm not going to get in the recommendations of the clinicians and all of that stuff, or the state departments. I'm more, where I'm worried about everybody, but the people that work with these animals and stuff like that. And for the public, making sure you guys are safe and understand what's going on. Okay. So, recommendations for farmers, poultry, backyard flock, and livestock owners and workers' protection. Okay. So, to reduce the risk, they recommend, and this includes, veterinarians, veterinarian staff, and responders, you should wear recommended PPE. Okay. The same PPE is recommended for persons exposed to any confirmed or potentially affected animals as for exposed poultry workers. You have specific recommendations. They want you to go, click the link, see the PPE recommendations for poultry workers. The CDC has all of this information on their website. This includes wearing an N95, filtering face piece, respirator, eye protection, and gloves, and performing thorough hand washing after contact, when in direct physical contact, or during close exposure to sick or off birds or other animals, carcasses, feces, pasteurized raw milk, or litter from sick birds or other animals confirmed to be potentially affected with the viruses. Okay. And workers should receive training on using their PPE and demonstrate an understanding of when to use PPE, what PPE, what PPE is necessary, how to correctly put on, use, take off, dispose of, and maintain PPE, and the PPE limitations. Okay, so recommendations for the public. Okay. People should avoid being near sick or off animals or surfaces contaminated with the animal's feces, litter, raw milk, or other byproducts when not wearing respiratory or eye protection. Animals in which the virus infection has been identified include wild birds, poultry, other domesticated birds, and other wild or domesticated animals, including livestock such as cattle and goats. As always, people should not prepare or eat undercooked or eat uncooked or undercooked food or related. Oh, my phone went off. Sorry, guys. Related uncooked food products such as unpasteurized raw milk or raw cheeses from animals with suspected or confirmed HPAIA H5N1 virus infection. Okay, we are done. Okay, we are done. So, yeah, that is what's going on. Uh, you know, the CDC has issued this, and I just want everybody to, just be informed about this information. This is why I'm here to talk about it with you guys. Leave a comment. Do you guys still drink cow's milk and stuff like that? I want to know. So make sure you guys leave a comment. But yeah, so they said, listen, we got a vaccine available. Okay. If things get out of hands, allegedly, we got a vaccine for it, because I feel like, yeah, the H5N1 has been around, right, for a while. So I feel like this is one of those things that they already um been prepared for, like they said, if things get crazy out of hands, and they haven't seen really much change in the sequence from the animal to the human. So it's like, okay, it's different types of the influenza, but we haven't seen a sequence change in this, right? Unlike the uh Rona, where it's just like it's allegedly jumping from animal to animal and mutating and doing all this extra stuff. You got different types and all of that because it mutated to a different host. It got into a different host and then mutated to adapt to that host and then jump to that host to another host. It's a lot going on. Okay, so but yeah, they said, listen, we got a vaccine already. because this is like one of those things that's been around for a while. So scientists were able to do trial runs with this since it's been a while for a long time. With the Rona, that was totally different. It was just like came out of nowhere, boom, boom, boom. Even though it's already other two strains, but it just was like this one was different, right? So, but yeah, so if anybody is out there working with around these animals and stuff like that, thank you from the people that eat off your labor. The people that may drink milk or you know dabble in chicken and all of that stuff, because working with these animals and around these animals and these zoonotic diseases, like they are always like changing, and you don't know when it's going to change. It's rare cases of mammals getting this particular in this particular case, but it's like still a little bit nerve wracking because you thinking it's like it's all good, whatever it is, what it is. But zoonotic diseases are a real thing, and yeah, they can change. I just feel like animals develop these different types of. This is what I believe in. I believe that these animals just develop these different types of um viruses and things to just like stop humans from eating them. Not in every case, but I believe in some of these cases, like the animals are just like something has to stop. The animal's body is like something has to stop. We can't keep going through this cycle. Like just leave us alone. Don't eat us. Now you can't eat us because you're gonna get sick. So, you can try to control these the situation, the circumstances, the settings that the animals are in, but push come to shove, uh nature, biology, whatever, it's going to do what it wants to do regardless, no matter what you do. Okay, it only takes a small amount, okay, to just be like change, switch. This is it's something different. Y'all don't know nothing about it, and it is what it is. But yeah, so you guys let me know how you guys are feeling about it. Like I said, if you work with these animals, be safe. Make sure you guys are wearing your PPE and are just up to date on your knowledge of PPE and what you can do to prevent exposure and stuff like that, because you working around these animals and then you bringing it home, child, is a mess. It's a lot. So it could be scary, but yeah, just make sure you guys are up to date on your knowledge of things. Make sure you ask your supervisors, and if you are the supervisor, make sure you are making sure your team knows everything that they need to know. Okay, make sure you guys stay safe and all of that good stuff. But y'all let me know how you guys are feeling about it. Make sure you guys leave a comment. Make sure you subscribe to the YouTube channel. Check out some of my YouTube shorts here for celebrity pets and celebrity animal interactions and encounters. Make sure you guys check out the podcast here. I have a playlist of the podcast, of the live playlist, and also the pre-recorded podcast. I do have a pre-recorded podcast coming up. I believe I'm going to do one next week. Yeah, but the next live will be tomorrow. Yeah, tomorrow at lunchtime. Like I said, it's always going to be between 12 and 1. Honey, I put the baby down for a nap. So I'll be doing a live tomorrow from either 12 or 1 p.m. Make sure you guys turn on your notifications so you guys can be notified when I go live. Okay. And I'll probably do 2 lives tomorrow, Wednesday evening, also at 6:30. But next one tomorrow, okay, between 12 and 1 p.m. Just stay up to date, turn on the notifications, all of that good stuff. Y'all are already know. Make sure you guys enjoy the rest of your day. It's Tuesday, it's Self Care Tuesday. This is when I do a lot of gardening today. So, yeah, I'm ready to go play in the dirt and plant some seeds and all of that good stuff. Make sure you guys love yourself, one another, your pets, and the animals. I'll talk to you guys tomorrow. Bye.